I'm Wynne Spencer. I'm the Programme Manager for Integrated Personal Commissioning and Personal Health Budgets in Lincolnshire. In terms of the programme delivery, we're obviously one of 9 demonstrator sites across the country for IPC, and we've aligned our personal health budget programme with IPC in Lincolnshire. I think it builds on a lot of the good work that we've done over many years, that health and social care have done over many years, around putting the person right at the centre of their services and working with people and their local communities and their natural networks. So in order to personalise services, we have to include people in the development and the delivery of those services. That's very fundamental to this programme. Some of the ways we're involving people have been to listen to people who currently have support from health and social care in Lincolnshire and actually hear their views and hear what's working and not working for them, and harness their energy and expertise around how they would like services to be shaped and delivered. In order to do that, we've been doing quite an extensive piece of work with the People Hub, supported by NHS England, in developing a local peer network of people who experience services and their carers, so that we can actually build on that and that they can influence our local programme but also influence the national programme as well. Success at the end of this programme would be, for me, really about making the whole process and system far more simple, easy to access, good, that people have good, relevant information when they need it. And actually we support people as they wish to be supported, and that when we're not needed, we actually get out of people's way in order to allow them to actually drive and have more choice and control around the support that they're needed, but that we're there when people need us.
My name's Justin Hackney. I'm the Programme Director for the Integrated Personal Commissioning Programme in Lincolnshire. I work for the Lincolnshire County Council, but actually work closely with Lincolnshire clinical commissioning groups as well. So the Lincolnshire IPC programme has got 5 work streams. The first work stream is around learning disability, people with autism, and also young people in transitions to adult care. So we're looking at developing 100 personal plans, support plans for those people, and also 65 of those people are expected to take or may choose to take their personal budget by direct payment. The other work stream is around people with severe mental health problems. So we're working with the local foundation trust to actually understand people who have been open to them for over 5 years, and then to talk to those people about their interest in trying to meet their needs and recovery in a different way using personal health budgets and integrated personal commissioning. Another work stream is around our local neighbourhood teams. So we're working with local GPs and getting the local community involved, including the voluntary sector, people with experience of dementia, people, patients with dementia as well. And actually, again, looking at early intervention and prevention, and working with people to meet the needs in a different way, and to delay the need for higher levels of care as well as part of that programme. The fourth work stream is around sort of processes and procedures. So through personal health budgets and integrated personal budgets, there's a need to actually make payments and manage those accounts, etc. So we need to integrate systems and processes as well. And we're looking in terms of actually joining up documentation, so we have one sort of common format for support plans, etc. as well. And then the fifth work area, which is really cross-cutting, is the work that we do with our stakeholders. So it's really important that the people who want to or need these services actually help to co-produce those with us. So as we're going through the process of developing personal health budgets or integrated personal commissioning, we're learning on the journey in terms of how we can make improvements, how we can make it more efficient and more personalised to their needs, really. So it's sort of continuous improvement in terms of the way that we're actually facilitating things. and also getting their views in terms of how they want services to develop locally. Things that have excited me in Lincolnshire about this programme is in terms of the level of engagement and excitement about integration and the new way of doing things. And certainly at the local grassroots in terms of around our GP surgeries and our neighbourhood teams, and the opportunity to be able to do things differently and to stop needs escalating, and in particular giving people more choice and control of their own care needs. You know, all these things are an exciting new way of doing things. Some of the challenges around integrated personal commissioning and personal health budgets is that sometimes there's a lack of understanding in terms of terminology. So we need to do some work in terms of making it more simple for people to understand what it's all about. But there's also some mythology in terms of that people use personal health budgets or personal budgets inappropriately, or that they cost more money. Overall, the evidence shows that that's not the case, that when people use their personal health budgets, they have more control and they make better choices in terms of how to meet their own needs. And that tends to cost less money than before, but you get better outcomes.